Hello and welcome to this edition of Bayou Time. I'm your host, Keith Whiteside, licensed clinical social worker with Terrebonne Home Care. Very glad you're joining us. However you may be joining us, we appreciate it very much. And it's always exciting to talk to you about some wonderful things happening in our community that normally takes place with Terrebonne General Health System, as we're excited to welcome to the program Mary Miller. Welcome to the show.
Well, thanks for having me.
Absolutely. Of course, Mary is the Vice President of Physician Services, and we've seen so many good things happening at the hospital here lately. So a lot of good things happening. So thanks for coming on to talk about some of those.
Absolutely. Absolutely.
So this mobile care clinic is something that you guys have been talking about for a while. I know Terrebonne General spends a lot of time figuring out what are the needs of the community, how do we service that, and how do we bring them the care that they need. Tell us a little bit about how this came to be.
Well, it came to be actually after Ida.
Okay.
Because of the problem with the healthcare system at the time, and so we decided that we needed to provide services to our community. And so this was one way of doing it. So we had the ability to actually, with one of our partners, to use their mobile clinic at the time. And we went to various areas of the parish to provide healthcare services that were badly needed.
Right. And I remember that. We were really excited to be able to kind of get that together and bring the care to them. And now Terrebonne General's kind of showed that for themselves.
Absolutely. So we're so excited. And let me tell you a little bit about our mobile clinic.
Okay.
So our mobile clinic is a customized vehicle equipped with 2 patient exam rooms, medical equipment, and medical supplies. And it's going to afford us the ability to now do it on our own as far as traveling throughout our community, provided needed healthcare services.
And it's something that you guys kind of have a partnership always about making sure that we're taking care of the needs of the community. And it's such a novel idea that since the storm and since there were so many, like you said, broken areas, realizing that that's a need, and now just getting that out. It's great. You got 2 different exam rooms.
Absolutely.
Right?
Absolutely. We provide quite a bit of care on that community bus. We are going to actually perform healthcare screenings.
Okay.
And also have providers present to be able to do actual patient exams.
Yeah, and so it's not only just being able to see. At one time, screening was one of the few things that we could do, right? It was one of the things that we did from a mobile perspective. Now you get to really treat the patient. So if there is a screen or some of the evaluations that they do, you got providers there to address that.
Absolutely. Absolutely.
Yeah. And I'm just thinking about the person that maybe doesn't know that they're a diabetic, right? They come in and they can test their blood sugar. And if they got a really high blood sugar, they can address the need right there.
Absolutely. And, besides addressing the need, they can also, we believe in connecting with our community partners.
Okay.
And so they can actually refer them back to their primary care providers in the community.
Well, or maybe even establish that, right?
Absolutely.
Because some of those people we know that, especially here of late after the storm and after COVID, people have been a little concerned about getting out. They're not wanting to maybe follow up. And this is a way to maybe get their follow-up where they don't have to go very far.
Absolutely.
Because it's coming to them. So very cool.
I think of it as bringing healthcare closer to home, closer to them.
Wow. And again, it's one of those things where maybe it's a family that doesn't maybe have transportation. We see that all the time.
Absolutely.
And where they're, just that's a struggle for them, or or all of their resources are going to redoing their house or getting their shutters, whatever it may be. They don't have the gas money to be able to get out and get away. And so again, just that mobile clinic, being able to go and do that and be in different areas, and just being able to see what the needs are of those people. It's just really, really cool.
Oh, definitely.
Yeah.
Mm-hmm.
And so is the staff excited? Tell me how the staff that y'all have kind of coordinate, are they excited about being able to do this?
The staff, they're very excited because of the opportunity. We had that exposure post-Ida. And some of the stories that you're telling about limited access to health care. This is an opportunity for us to provide additional health care services to very key areas of our parish, whether it's Dularge, whether it's Gray, certain areas in Houma. So I think it's very great. We will have physicians as well as nurse practitioners, medical assistants, as well as patient access individuals to really help to pull all of this together.
Yeah, it's one of those things that I think very often. I got a chance to spend time with some cardiologists here of late. And it was interesting to hear them tell their story about the fact that they wanted to get into medicine so that they could go and meet the needs of the people. It was really interesting to hear that term. A lot of the people that are associated through and with CIS, with Terrebonne General Health System, that's their goal. They got involved in healthcare, and for a lot of nurses, I know, got involved in healthcare so they could go and meet the needs of the people. And this is just one of those real unique ways to kind of think outside the hospital, if you will, into a vehicle to be able to provide that
Well,
care.
you're improving access to patient care. And, you know, I heard a wonderful story when we were actually during the time of Ida that one of the individuals stated that they wouldn't leave their home. So by us being in that particular area, they actually came to the mobile unit, and we were able to provide healthcare services as well to be able to connect that person to get transportation, to get back to the hospital, to be able to get additional tests and workup.
More treatment that they really needed.
Absolutely.
Wow. That's what a great story, because I think what we're doing is we saw very often where medical and mental kind of ran into each other.
Sure.
Some medical issues, but a lot of mental issues. And so we had a kind of a broken system at that time.
Absolutely.
You got to go out and see that. And somebody that wouldn't leave their house, now all of a sudden they're not only coming to the mobile unit, but you got them identified with the need, motivated, and they got to follow up with those tests that needed to be done.
Absolutely.
And I love the great communication that you have with the system of review, kind of chart review, and where that can all be in one place, where the doctors know that, the hospital knows that, patient and family knows all that information that they can access.
And because of technology, so
Right.
we have an electronic medical record system. So even on the mobile clinic, we're able to utilize that system and to access their records.
One of the things that is really exciting that takes place right there by Terrebonne General is the market at the Marina. It's really exciting because it takes place the first weekend of the month, and it's right there at the Marina underneath the Twin Spans, adjacent to the hospital. They have local craft vendors and local farmers. They have items for sale. And at this unique event, it's grown since its inception last year, and they have that every month. So that's exciting. But this particular month, June 3rd, on that Saturday, we're also going to have the mobile care clinic. So this is exciting.
It's very exciting because this is our first event that will be able to provide services to the community on our mobile clinic.
Wow. And so let's talk about some of those screenings. What is it? And because I know we talk about that. People wonder, what can you get when you go there? And we want them to know that. Let's talk a little bit about some of the things that people can
Absolutely.
get
So we're going
access
to perform a health history.
Okay.
As well as cholesterol screenings, blood glucose.
Okay.
We're actually going to do an in-body scale to actually measure your weight and your body composition, what it's made up of muscle, fat, and water.
Right.
We're actually going to have a nurse practitioner there to be able to review actually the test results and to provide advice as far as what are the next steps. So we're very excited to be able to offer those things.
Wow. And again, that's very comprehensive. You know, it gives you a great snapshot, and you've got a nurse practitioner, a mid-level, who's able to kind of evaluate that right there to see how things are going. And we gave that example earlier, right?
Absolutely.
And so we talked about that. I know from me learning what I've learned, and I give all credit to Terrebonne General about that. Just, you know, if their blood glucose is 300 or above, that's something that's awfully concerning.
Absolutely.
That nurse practitioner can address that. And if it's not, if it's a little high, they can address that as well.
Absolutely.
So very, very cool. And again, we need to know those things. Blood sugar, glucose, we need to identify those things. Body mass index, very important to know your BMI to be able to figure out, you know, what do I do next? And so really cool. Now, the other thing is that people can register ahead of time.
We encourage them to register ahead of time, and they can register at our freehealth.eventbrite.com.
Okay.
However, if they miss the opportunity to register, we will be able to register on site.
Okay.
So we do encourage them to come by the mobile clinic and to try to register, because we only have so many slots between the hours of 8 a.m. and 12 noon. So we want to be able to provide as many screenings as we can, and everything is free.
Right. That's wonderful. And again, free. It takes about 10 to 15 minutes on average.
Per person.
Right. But again, just trying to figure that out and do the timing on that as well. And so again, if you want to make sure that you get more information about that, there's a phone number that people can reach out to
Absolutely.
if they want more information.
Yes, that number is 850 6214.
And again, you can call that number, or you can go and just register at Eventbrite. As Mary mentioned, it's freehealth.eventbrite.com, and be able to get more information. And we encourage people to do that.
Absolutely.
You know, we're hoping for another beautiful day, another beautiful Saturday. Go out and check out the market at the Marina. It's really neat. You get to see some fresh food items. Again, goes right in line with better health.
Absolutely. And we're going to have additional information for educational purposes dealing with diabetes and hypertension, as well as healthy lifestyles.
Oh, wow. And again, you know, just knowing that we live in South Louisiana, we tend to lead the country, and South Louisiana kind of leads the state in some of those things with diabetes and with heart disease. So very important to help make sure that we're educating. That's something that Terrebonne General has been so dedicated to, making sure that we're educating for the idea of prevention of some of these diseases, right?
Absolutely. We actually conducted a community needs assessment that could be found on our website.
Okay.
And so there are some key areas that we need to focus on, and that's diabetes, heart disease, hypertension, cancer, and healthy lifestyles.
Yeah. And again, some of these testing, this nurse practitioner can kind of help figure out and just give us kind of a quick snapshot of our general health. And then they may make some recommendations about follow-up, right?
Absolutely. Absolutely.
Yeah. Either with the primary care doctor, whomever that may be, or with the hospital.
Yes, you really want to have a primary focus on prevention as well. So if you feel like you don't have a problem, then this is an opportunity for you to see, well, maybe some concern. So we do encourage anyone, whether you're feeling bad or have any problems, if you don't have any problems, you think you're healthy, just to go ahead and get your screening done. That's
Right.
very important.
Yeah, because, you know, and it's a really important point, because so very often we may have some minor aches and pains, and we kind of think that nothing of it. It may be the beginning of something, and if we can identify it early, prevention is so very, very important.
Extremely important.
Yeah.
Extremely.
All right. So, Jason, put that up one more time. Want to let people know where they can go, the website, if you're interested. On June 3rd, you can go to freehealth.eventbrite.com. Register for this event. It is on June 3rd from 8 to 12 at Market at the Marina, which is right there under the Twin Spans, right next to the hospital. Or if you just want more information, if you would like to talk to somebody, there's a telephone number there, 985-850-6214. Some really good things coming up. So we got about a minute left, Mary. It's one of those things that I like to think about in the many years that I got to spend at the hospital, not even close to the many years that you've spent at the
Absolutely.
hospital. All of the things that you've seen. This is another great example of Terrebonne General doing more outreach and part of the growth. Kind of exciting, huh?
Very exciting that we have the ability to do this. And, you know, we definitely partner with our community leaders, the Foundation of Terrebonne that was very instrumental in helping to support this initiative with a very generous donation of $75,000 to help to purchase this vehicle.
Wow. And again, those partnerships are really what make everything work. We're so very glad at HTV to have that partnership as well. So we thank you for your time and coming on. And we appreciate the fact that you're really spearheading the prevention and talking to people about early screenings out in our community.
But thanks for having me.
All right. All right, guys, thank you for joining us. Of course, a whole lot more information here to follow. Don't go anywhere. A lot more Bayou time right here on HTV.